I'm looking for good ideas. I don't care if you're a Republican, Democrat, Independent, Libertarian, Green Party, whatever it is. I want to hear your good ideas. In the course of about 4 weeks of doing these kinds of listening sessions, I found that there is some consensus, at least in our congressional district, around some of the issues. And let me just talk about those before we talk about veterans. People really feel across the board that we need to take care of our veterans. They've earned that. They should get the care they were promised when they signed up. Secondly, most people who are on Medicare are pretty happy with it. They don't want our thing is we want healthy children. We know they're our future. And so we want them to grow up healthy, get good education. I think you really hit on one of the key components of the plan, and that is options. And I would like to see as many options as possible. We've been very concerned about how this is going to affect small businesses. And I was meeting with some small business owners the other night who were telling me about the struggle they have every year when they have to renew their policy because the premiums go up, coverage goes down. They can't compare apples to apples. It's more like comparing apples to bananas. But they've worked with their employees in terms of what kind of coverage they want, so there's a dialogue there. I think it's going to depend on whatever your employment situation is. But I really hope that there are as many options for people as possible. Those people who have insurance they like should be able to keep it. I think the real key is going to be making it affordable for our small businesses so that they can continue to cover their employees. Process. What you described is really a broken system. And people want, as a general rule, want some kind of reform. But most people do not want a single-payer system, and they don't want to fix what's not broken. So we have a lot of good things in our healthcare system that we want to keep. Medicare is one of them. Most people are very happy with their Medicare. Some people tell me that they think they pay way too much for prescriptions. I think a reasonable requirement for the government plan would be that they negotiate lower prescription costs for people who are on Medicare. That would make a difference. We don't need to throw out a program that's working. So I'm looking for reasonable, common sense solutions, not for a massive overhaul of healthcare.
Preventive health, the reason so many other countries in the world, especially Western Europe, have better health care results is because they focus on preventive health care. Preventive health care is getting every man, woman, boy, and girl access to a primary care physician in a reasonable amount of time so that illnesses and problems can be addressed very early in their care instead of until it's a catastrophe and it requires huge amounts of expense versus preventive health care dollars. Thank you.
Let me start by saying that my dad had a general store right here. His principle was don't spend more money than you make. And I think that we need to follow that in Washington, D.C. And I've been talking with my colleagues about doing more with less. So I'm very concerned about our national debt. I'm very concerned about spending. I recently voted against the energy bill for that very reason. How we pay for health care, for what we're talking about, is the question. And I think that there should be a clear answer to provide the American people. There is a problem. There are some ideas and things that we could do to reduce costs. Prevention is one. We have a great program in Safford, which is called the Asheville Project. Maybe some of you have heard about it. And this is private. This is a private insurance company. They don't require a copay for their insureds to call a physician or their pharmacist, and they targeted the diabetic population. What they found is, and the doctors on the panel may be interested in this, is it opened that dialogue so that if people had questions about their tests, their glucose tests, their level, they could call, get a quick answer, make a change very quickly in their treatment, their emergency room visits went way down, their complications went way down, and this is a 15-year program that has extensive cost savings in it. So I know there are other things out there, models that we've used that we already know save money and save costs.